Hey everybody, and welcome back to another episode of A Talk with Your Doc. I'm Dr. Jeff Teeter with Titan Health Direct Primary Care. And today we're going to talk a little bit about some of the sneaky creatures that live back in this stuff. Join me for ticks and tick-borne illnesses coming up next. Welcome back, and today we're going to talk about ticks and tick-borne illnesses. And we're going to focus on 3 different types of ticks and 3 different types of illnesses, though there are a plethora more for you to discover on your own. Ticks are members of the arachnid family, and they're ectoparasites, which means that they feed on the blood of other creatures. And that's how they live, grow, and reproduce. Ticks have 4 different life stages, and those are depicted right here. You've got the egg stage, the larva stage, the nymph stage, and then into the adults. And this is important because we need to be able to identify the tick and what stage it's in, because only certain stages are infectious. Over here you'll see the tick life cycle. And adults lay eggs in the spring, and those eggs turn into larvae late spring, early summer. And those larvae, what we would call a seed tick, they primarily attack mice and birds and things of that nature. And then it's not again until next year in spring and summer that those become nymphs. Now, the nymphs and the adults are the ones that spread disease. So these are the warning times, late spring into summer. Those are the times when we have to be careful about getting Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, those kinds of things. Then it comes all the way back around, and the adults continue to feed, and they're ready to reproduce in the spring. The first tick we're going to talk about today is the black-legged tick, and that's a member of the Ixodes genus. These guys transmit something called Borrelia burgdorferi. What's that? Well, you know it as Lyme disease. Now, you can see on the map behind me here that we in Missouri are right in the middle of Lyme disease territory. But in reality, let me show you this other map. It is more of a northeastern disease. Now, it happens here, but with less frequency. The primary infection that we see in Missouri is ehrlichiosis. But it's still possible, and the complications with Lyme disease are severe, so we need to keep our eyes out for it. Lyme disease has early stage symptoms and then late stage symptoms. And every one of these early stage symptoms are pretty unanimous throughout all different species and all different bacterial infections. And that includes fever, rashes, muscle aches and pains, joint aches and pains, feeling tired. Another early sign of Lyme disease is erythema migrans. Well, what's that? Well, it's that classic bullseye rash that you see on people who have been infected with this particular bacteria after a tick bite. And it's this central red area surrounded by normal-ish looking tissue, and then another red ring all the way around it, like a classic bullseye. That is a classic erythema migrans rash, and 70 to 80% of people will get it for those that are infected with Lyme disease. Now, if you're unfortunate enough to not have this treated, and you get to the late symptoms from Lyme disease, you're now starting to experience extreme muscle stiffness and joint stiffness. Lots of aches and pains throughout the body, and if this goes on long enough, you can even develop autoimmune diseases associated with this, and those complications last for a lifetime. Now, we'll talk a little bit more about this when we come down to the treatment side of things, but right up here there's a little diagram that shows feeding times. Well, it's important to remember that, and it's also important for the diagnosis and treatment of these diseases, that these ticks feed very slowly. And that bacteria, whichever one it may be, it's in their gut, and it has to have time to come up, get into the salivary glands, and then be injected into your bloodstream. So it's important to know how long that tick has been on you. Because if it's only been 24 hours, your chances of having one of these diseases is slim to none. But if it's been on for 72 hours or longer, Now we're worried, and treatments start right about 36 hours of ticks being on you. The next tick we're going to talk about is the Lone Star tick, which you'll see right here, of the Amblyomma genus. They primarily transmit ehrlichiosis, and ehrlichiosis is the #1 tick-borne disease in Missouri. We've seen Lyme disease and Rocky Mountain spotted fever, but ehrlichiosis is primarily what you see in this area. All of these tick-borne illnesses can have rashes, but the rashes are a little bit different in each one. In this particular case, the rash is called starry, or southern tick-associated rash illness. And that can be whether you are infected with ehrlichiosis or not. That's just from the tick bite, and it's kind of just a classic circular rash. Doesn't usually have the bullseye appearance that you see in Lyme disease. Ehrlichiosis also has early and late stage symptoms. The good thing to note is that most of us develop a good immune response to it and clear it and may never have symptoms at all and won't need treatment. However, for those that do get symptoms, it can be pretty severe. And again, the early symptoms are the muscle aches and pains, the headaches, the fevers, feeling really crummy, joint stiffness. All of those are very much the same for all three of these. In this particular case, when you get on to late onset of disease, it can cause meningoencephalitis. What's that? Inflammation of the tissues surrounding the brain, and that can be lethal. It can also cause severe bleeding disorders, organ damage, and death. So it is important to be treated for these if you suspect that you have it. The final tick we're going to talk about today is the American dog tick, or the dermacantor tick. That causes Rocky Mountain spotted fever, which is caused by a little bacteria called Rickettsia rickettsii. Again, the signs and symptoms are very much the same. Headache, fever, rash, feeling lethargic, not feeling good at all. It also comes with a characteristic rash on its own, and it's spotted, rashy dots, Rocky Mountain spotted fever. Most of us get through this just fine. Same with ehrlichiosis. But some of us do have those symptoms that last for a prolonged period of time. And treatment with a particular medication can either prevent you from having these diseases or help you once you're infected. So, how do we treat these? Well, right here. Doxycycline is the #1 antibiotic that you should get if you have any one of these particular tick-associated diseases. It's very effective against all of them, and in short doses, it doesn't cause any of the problems that you get scared about with taking long-term doxycycline in children, like yellowing of the teeth and other issues. So it's very safe, especially in the short durations. And the other good thing about it is that you can use it prophylactically. So if you know that you've had tick exposure, and then here's the important part, that the tick was attached to you for 36 hours or more, then you can get a one-time dose of 200 milligrams of doxycycline and prophylactically treat yourself. Prevent it before it ever happens. That is the best way to attack these kinds of things because doxycycline is so simple and that one-time dose is so effective without the side effects. Now, if you do end up needing the full round of doxycycline because you've already developed some of those symptoms we talked about, which are fever, rashes, muscle aches and pains, etc., then you'll be on doxycycline, 100 milligrams twice a day for 14 days. And that usually clears things up. Well, guys, I've had a great time talking to you about ticks and tick-borne diseases. I hope you learned something. If you have any questions at all whatsoever, please feel free to contact me. My phone number is right down here on the bottom. Give me a call. Let's chat about this or any other medical issues that you have concerns about, and I'd love to chat with you. Otherwise, visit my website, which is titanhealthdpc.com, and check me out on there. And make sure you like this video and see some of the other videos that I've put out. Thanks, everybody. You take care of yourselves. I'll see you soon.